absolute pleasure to be here. What a nice occasion to be part of this group. First of all, I'm proud to say I belong to the 1985 Stanley batch. Yeah. And what a, I think we need to pat ourselves on our back for being such a nice batch. Not only because of what we accomplished professionally, every batch of physicians, every batch of engineers, professionals, they all accomplish things. We have done something that not very many people do. We have leveraged that friendship into something bigger. We want to leave something for the society. We are already doing social work, and we are also trying to create an educational forum to educate ourselves, knowing that we do not know everything, and we are creating some form of legacy in form of having this information available to the next generation also. So I do believe, in fact, sometimes my wife comes and says, is every batch of medical students, are they all as accomplished, or is your batch alone unique? Because every time I tell her, okay, this person is a professor of this person is doing this, and she asks, every batch is like this. I said, no, our batch is unique. So, yeah, the only thing that Ravi left out was that I only remembered 1/3 of our the class attendance list, which started at Anandi and ended at Yamini. So, Anandi, Aruna, Beena, Bona, Cynthia, Ishwari, and Joseph. Okay, and then I could go on. But, yeah.
So, Venkat, you have not done everything. I'm not totally.
No, that batch I never bothered. I don't think I was very interested in that.
Don't do the upper tier. Don't do the upper tier.
So, having said that, this is a very informal talk. Please stop me anytime, and if you feel that what I'm saying doesn't make sense, stop me, confront me, and say that this is not scientific. At the same time, if you feel this is scientific, then we'll keep going along. I will try to keep track of the time, but I'm very poor at that. So if I'm running beyond schedule, please stop me and guide me there. So it's a honor to speak after Bala, because Bala practices what is being said here. So coming to lifestyle diseases, mind-body approach. First of all, what exactly is this mind-body medicine? Srikanth, 2 years ago when I told him I'm teaching mind-body medicine, he said, if only you were not saying this, I would think this is a big udas. That's what he said. So it's not udas, because the National Institute of Health says that this is what mind-body medicine is. Ways in which emotional, mental, social, spiritual, experiential, and behavioral factors can directly affect health. See, the key thing here is the word directly. Why does it say directly? Because, say for example, somebody loses a job, or they get divorced, then they get depressed, they start drinking, and that drinking can lead to cirrhosis of the liver, and thereby it affects health. See, that connection we all know. But here it says directly, how does the divorce affect this person's health? How does a spiritual experience or a spiritual practice, how does that affect health? That is where mind-body medicine comes. So, I always say that there are 4 levels of medical proof. The first level is what you get in WhatsApp. Like Kothumali will cure cancer, somebody will say that. So when Kothumali cure cancer, anybody can write that in WhatsApp. They can be wrong, and they can be wrong for this. They can be wrong, and they have wrong reasons also. But they don't mind, because they just put it in WhatsApp. Nobody cares. Let's say I'm a practicing physician. I have a patient with left lower quadrant abdominal pain, and I think the patient has pelvic inflammatory disease. I give antibiotics, ceftriaxone, from Aristo Pharmaceutical, and that ceftriaxone cures the patient. But the patient ends up with diverticulitis, and the patient is better. Remember, I was wrong. or I was right. I gave the right medicine, but the reason was wrong. So for a practicing physician, as long as you are right, the reason doesn't matter. If you end up with the right diagnosis, the right treatment, and the patient gets better,